I wanted to start with Mr. Bernard. Oklahoma is a land of plentiful food, just like America is. When you think about it, the productivity of agriculture over the last 50 years has been nothing short of miraculous. Oklahoma helps feed the nation, which feeds the world. But yet, in Oklahoma, we also eat too much food. We have a problem with obesity. And yet, your organization recently put out an extensive report noting that about 652,000 people, a third of them children, are food insecure or hungry. So I would ask you, how could that be? Who are these people?
So that's a more complicated question or answer than I can probably put into this panel. But I guess first what I would address is obesity is a problem in Oklahoma. That doesn't necessarily mean people are overeating. It may mean they're eating the wrong foods. And in fact, food insecurity makes somebody more likely to be obese because you don't have consistent access to food and you don't have consistent access to healthy food. People who are food insecure are more likely to be obese, more likely to be diabetic, at higher risk of heart disease, and all sorts of other health indicators. I think it is shameful that in a country as rich as America and with as much food as America, that anybody goes hungry or is food insecure. But it's a nature of a multitude of things, including unemployment rates, economic indicators, all levels of different things. But if nothing else from this answer, I'd like to get the point across that just because people are obese does not mean they're overeating or have too much food.
Was the problem of hunger extensive in Oklahoma compared with other states, and is it getting worse or better?
So it is extensive. It's about 15.5% here versus 13% nationwide on average. It's not necessarily getting worse in terms of raw numbers, right? So food insecurity goes up and down with the economy. I think the answer I would give, and really what my organization is focused on, is there's huge opportunity to address food insecurity in our state that we have not taken advantage of. We do a ton. Many people are addressing it in many ways, including both of my colleagues here on the stage. But there's a lot more resources we could be accessing that we have not historically as a state.
Ms. Fitzgerald, I'd like to ask you, the Regional Food Bank of Oklahoma is like Grand Central Station. You're distributing food to the needy through many hundreds of other groups and helping enlist thousands of volunteers. I think as I saw that you provided meals for 160,000 people each week last year. And there are just a whole range of programs, a backpack program, a summer feeding program, school pantries, you name it. So the question is it hard to keep this feeding operation going every year? People donating constantly. It seems like we just always have hungry people. How do you sustain this?
Well, if I may just build a little bit on food insecurity and then answer that question. I mean, I want to echo what Chris said. I think we live in a land where food is ubiquitous and it's all around us, and those of us who have ready access to it find it hard to fathom that people may not have that. And what food insecurity really is about not having, as Chris said, consistent access to healthy food. And so families are in position, you're food insecure if you're having to make decisions, which about 70% of our clients through the Feeding America network have to make on a monthly basis. Do I pay my utilities or do I buy food? Do I, pay my car bill or do I buy food? So hunger, and when we talk about hunger in America, it's an economic issue where people are having to make rational economic choices between food and what else they need to buy. And really, for about a third of American households, that's the case. It's just where you start to see about 70% of our clients who are having to make those decisions on a monthly basis. And then it is also an access issue. So we have in our state, at least the data I saw from the USDA, 54 of our 77 counties have food deserts within them. And what that means is that you may be struggling economically, but then you also don't have a grocery store nearby where you can get access to healthy produce or good food or much food. So you might be shopping at a convenience store, and that's where these issues become pretty complicated and interrelated with what people are consuming and their impact on health. So the food banks, to answer your question, the food banks together, the Regional Food Bank of Oklahoma and the Community Food Bank of Eastern Oklahoma together feed about 160,000 people a week. And we do that, as you said, through a range of programs, many of which are specific to certain populations, like our backpack program, which is a great example. Specific to children in elementary school, the Regional Food Bank has 500 schools that we serve on a weekly basis, getting backpacks to those kids. This year, we'll be serving about 21,500 children. And that allows those children to bring home in their backpack shelf-stable food that will help that family stretch that dollar, help that child have access to food. But beyond that, the bulk of our operation is distributing food to our program agencies and other partners, which equate about 1,600 throughout the state between the two food banks. And together we put out about 80 million pounds of food. And you're right, it is an immense operation. I don't see it slowing down at all. We have, there is something very tangible and powerful for volunteers and donors, from food companies to financial donors to anyone, to know that you're solving a problem of hunger and access for people. So we have been very fortunate, as has our sister organization, to enjoy great support from the community, corporate support, faith-based support, you name it. And but it's an immense operation, to be sure. Let me know if I didn't answer that.
Fine. Mr. Hill, you are at the Oklahoma City Public Schools, the district, but you also were a principal.
Yes, sir.
So tell us, how widespread is hunger or food insecurity with students and families in the district, and how does that play out in their lives? How do teachers and principals see that play out?
I've had an opportunity to mainly be a principal in low-income schools throughout my career. And it doesn't change whether you're in eastern Oklahoma or here in Oklahoma City. Students who are hungry do not do as well as students who have been fed. I've always been fortunate enough to have good programs, feeding programs within the schools that I've been in, and Oklahoma City is one of those. We do a really good job of trying to feed as many children as we can a healthy, nutritious meal, breakfast, lunch, and now supper program. How does it play out? I can think of one student that comes to my mind right now that absolutely was hungry from the time he got to school. He would go get his breakfast. And of course, we have certain regulations on that, but we would make sure that we got him a little extra food through various ways. He always was the first one in the line to get his backpack when the weekend came. And we'd make sure that we purchased some other things that we could throw in there for him. But he was just an example that of a child that was absolutely not getting any support at home. You know, we did our thing through DHS and all the things that we could do that way. But when it came down to it, the child was hungry. When he did finally change circumstances in his life where he had the food security that he needed, he blossomed as a student. He was not a bad child ever. Matter of fact, he was that kid that kind of was in the shadows. But he became an academically superior child when he started getting the support that he needed. And one of those was the food that he needed, so he wasn't hungry.
We did a story recently, our reporter, Jennifer Palmer, about how so many school districts in the state have not tapped the federal funds to be able to expand their meals programs, and there are many more options available. Why is that so, do you think, and what's happening in your district?
I can't understand why schools are not doing that. We're looking for every federal dollar we can. I'll lay it out there. We want to tap into the resources that we can get. We serve over 8 million meals, breakfast and lunch, during a course of a year. We've started the supper program at Capitol Hill High School. That's been hugely successful. We're feeding over 100 students a day in that supper program. Next year, we will go with my fingers crossed and the support of everyone, we will go to a district that will have free meals for every student in our district. We will not be charging for any student a meal. That is breakfast, lunch, and supper, and I'm pretty proud of that. But we've been able to do it because we have worked really diligently to use the federal dollars that we are getting to making sure that we're saving everything we can in our operation program, and then we put it back and for the students so that they can have the meals that they need.
Mr. Bernard, as I mentioned, there are just many programs that seem to at least attempt to provide food and nutritional education and others to families across Oklahoma. But you have looked at the whole landscape. What are the biggest issues? What are the biggest barriers to getting more people fed?
So, I'm going to back that up one step. So there are a lot of federal programs that we as Oklahomans have paid into already that make resources available to address hunger in our state. So that's school breakfast, which is reimbursed to school districts via federal government, school lunch, after school meals, summer meals for children as well, and then SNAP, which is traditionally called food stamps, and WIC, which is for mothers and young children under 5. Our assessment looked at it, and we think by setting reasonable standards of participation, right now we have a ton of eligible folks who are not getting access to those programs. We could bring in an additional $400 million into our state to address hunger. Feeding America, which is the group of food banks across the country, estimates we need right around that to fully address hunger in our state. So the barriers to it, I think there are quite a few. One is just coordination and organizing and support, right? So it's no secret that government agencies are struggling right now. Budgets are being cut across the board. Large districts like Oklahoma City have the advantage of a good administrative body that can take advantage of these programs and navigate the bureaucracies. Smaller districts don't necessarily have that. And when you're focused on putting out fires or just keeping your department going on a daily basis, it's difficult to go after new and innovative things. So part of what my organization is meant to do is come in and provide some of that organization and support as school districts or other organizations get into this. I want to make sure I mention Superintendent Hoffmeister and the State Department of Education have really made these programs a priority for the department and supporting districts into accessing them. So it's a matter of access and availability and reaching the people in need. So a great example, you have to find touch points. Individuals who go to the food bank may not necessarily be accessing every program they're eligible to. And as a result of that, the food bank is filling gaps that federal programs that we've already paid for should be filling, where the food bank could then go to filling the emergency need and needs that are outside of the realm of these federal programs. So I think it's a matter of education of individuals. It's a matter of parents and other people holding government agencies accountable and saying they want access to these things. And then it's a matter of organizing collaborations of service providers, government departments, and stakeholders within the community to create the kind of system and network you need to fully get the resources to the people who need them.
And if I may, I'll give a good example, I think, of what Chris is talking about, where we have a tremendous opportunity in Oklahoma, and Hunger Free Oklahoma is going to be a big, helpful partner in that. We rank 51st in the nation in the number of children who are participating in a federally supported summer feeding program. I know these numbers aren't totally correct, but I think we have over 400,000 kids who participate in the free and reduced lunch program during the school year. And last year we had around 18,000, maybe 19,000 children who participated in summer feeding. So the question is, these children we know who are so dependent on getting meals during the school day, how are they getting access to that food during the summer? And the biggest barrier to that, to be honest, is once you get out into communities and rural communities, those meals, which the food banks can provide. There's federal support, as Chris said, that we could be drawing down in the state, really would cost us nothing as Oklahomans. Win, 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 we get the kids fed. But we need community sites that will host churches and schools and, Ys, and many of whom are doing that. But it does require organizing on the ground to get those organized. And then there are transportation challenges. So if you're in a rural community and you, as a child, your family lives 4 or 5 miles away from that local Y that's providing the summer meal program, and you've got no way to get there, that's another challenge. So what's very helpful with all of the partners coming together, schools, Hunger Free Oklahoma, food banks, is we all play a role in helping leverage and optimize what's available to us. And I think that that's one area that we really want to see our ranking improve.
Mr. Hill, there are some people who would look at what the schools are doing to provide meals to children and say, that's not really the school's role, is it? And that's the parents' role. So why are we spending extra money in our schools and districts and spending all this time to feed children?
Well, over the years, we've taken on a lot of roles that maybe 100 years ago were considered the parents' roles. A hungry child, no matter what anybody has said nationally lately, a hungry child does not do as well in school. It's just the bottom line. Students have to have their basic needs met, and hunger is one of them, before they can become the full student that they need to be, before they can really blossom and be the person that we expect them to be. And it may not be in some people's mind that it's our responsibility, but I would argue tooth and nail that it is our responsibility. I would say that we have other responsibilities to the children in our district other than just feeding them. I think that we need to be that support system to meet their needs. And so I don't apologize at all for doing everything we can to meet the basic needs of children.
Mr. Bernard, I'd like to ask one more question. If you were to put on the skeptic's mask, so to speak. The word hunger is very powerful. It implies in some ways almost malnourishment or even starvation. But yet, when most nonprofit groups and the USDA itself describe it in a different way, and they would describe it as food insecurity, which is a lack of access at times to enough food for an active and healthy lifestyle, and limited or uncertain availability of nutritionally adequate foods.
Right.
Is the word hunger misleading?
I don't think so. So it was hunger. Food insecurity came about, if you read the history, when people were interested in avoiding the sort of PR disaster that came along with poor people in the South actually being hungry, right? I think if an individual is food insecure, they are going hungry at times during their lives. Hunger has a lot of different faces, food insecurity. It can be seasonal if you have a seasonal job. It could be at the end of the month, just like Katie was talking about, as you're starting to run out of funds and you're making decisions between paying bills and buying food. It could be because of a family crisis. There are a lot of families in Oklahoma who, if their car breaks down, they're making some really serious decisions about where their family's going to suffer that month, right? I don't think it's misleading. I think it's actually a better characterization than food insecurity, which just has no real concrete picture in somebody's head. If I could also jump back to the previous question about schools' responsibilities, I think you have to look at, first of all, from a state perspective, that's the wrong debate. This program already exists and we've already paid for it. So we're not spending extra money, we're bringing our money back to the state to feed our kids, to make them more successful in school, which ultimately leads to better outcomes in our state. And I think that's how you have to look at all these programs. It's a return on investment. I used to work in criminal justice reform, and everything we did was about how early can we intervene and prevent the later costs. And that's exactly what this is. A young person who's food insecure is more likely to have behavioral issues, more likely to be suspended or expelled from school. They have lower test scores in math and reading. All of those things hurt our state in the end, to the tune of, just in healthcare and lower academic performance, It is costing our state $1.4 billion a year, and that's not including all of the other costs we put into it, right? So I think it's just about twisting the perspective. If you want to have a federal debate about the programs, that's one thing. I would still disagree with you and say ultimately we're saving ourselves a lot of money by having those programs. But once you get to the state level, we've already paid for it. And any attitude of it's not our responsibility is just leaving Oklahoma dollars somewhere else.
Ms. Fitzgerald, it's not just children, of course. They represent maybe a third of those who are considered hungry. So what's the snapshot, the typical snapshot of the person or the family in hunger? Mm-hmm. Is it primarily minority, or is it white? Is it women? Is it men? Is it adults?
Well, the populations that we see and the way we think about our work and how we structure our programs and services really are around children, as we've discussed, and not just the backpack program, but after-school kids cafe programs that are in partnership with federal programs in local schools, our school pantry programs, our summer feeding programs, and all of those. So there's children's programs, and then we're also serving working families and families. So that's the whole population of folks that, as we've discussed, are struggling to kind of put it all together in any given month over any given crisis. Food banks, as Chris pointed out, work in partnership on a number of federal and state programs that allow us to draw down some of that money from the federal government, but we also serve that emergency food role, and we serve that population that is not eligible for SNAP or WIC, because they make, a family of four for SNAP benefit, and Chris can correct me if I'm wrong, I want to say it's about $31,000, just $31,500 right now.
Maybe a little higher than
Maybe
that,
a little
yeah.
higher, maybe about $32,000. So let's say it's $32,000. Well, you make $32,250, you're out of luck, but you're still going to be struggling to make those ends meet. So we see a lot of families in the pantries that we serve, and then of course there are those populations that are not going to be in a position to provide for themselves in the same way. So seniors who are living on a fixed income is a major area of concern for us because that population is growing and the population is struggling. Disabled people, people who are struggling with many of our partners we work with, which are homeless shelters and other sorts of service providers with mental health challenges and others that are just, quite frankly, not likely to get in a position where they're going to be able to go out and become so gainfully employed that this issue of scarcity and economic vulnerability is going to be is going to be something that they're going to necessarily get over. So the systems of food provision that combine federal, state, and private charitable support are really critical as a safety net for those people who struggle. I met a woman at one of our food and resource centers a couple weeks ago who had a woman who I want to say was about 78, had $30 left each month after she paid her rent and her other things. $30. So she is a regular member and participant in this food pantry down in Durant, and we want her there, and she needs to be there.
So anti-hunger programs are really anti-poverty programs because you're left with these choices, food or medical care, food or something else. Finally, a question for any of you. No one knows what's going to happen with the state budget. They're searching for revenue, apparently. But if cuts are made to some of the agencies through which funds flow, departments of education, health department, Department of Human Services, how will that impact your programs or the programs in general on the ground, in the trenches?
So I can start. I think the budget cuts are scary, but for what we focus on, the argument I would make is it makes the federal resources we're not drawing down that much more valuable, and it makes the coordination and the public-private partnerships that much more valuable. I think we hope to not see those things cut at all at Hunger-Free Oklahoma because the infrastructure in those departments is key to being able to draw some of that down. But we are constantly focused on helping government be more efficient and draw down more resources to bring that about. And that I will say that my experience so far in the work Hunger Free Oklahoma has done is every state department we have gone to who's in charge of these nutritional programs wants to see more people have access to these resources, wants to draw down more dollars, and is really just, as I said, you have to sometimes just focus on the immediate when you're that thin in terms of personnel and everything else. And so I think it's up to all of the leaders of the nonprofits and the people who partner with those social service sectors to step up and say, we're here to help too, but also step up and say, these departments need support.
You know, as we talk about that, we're drawing down federal dollars, and our entire program is through federal dollars. As we are able to feed more children, what money they might have had to spend for food can now be spent for other things. So we're actually putting money back into the local economy in kind of a roundabout way, but we're taking our federal funds, we're doing everything we can at a district, and then allowing students to have the opportunity to do other things with that money that they may have been using for a free or for a paid or even a reduced meal. So I feel really good that we're doing our part in helping promote the economy by doing this.
Let's open it up to the audience. If you have questions, raise your hand, and we have Evie and Sierra on either side of the room. Any questions? There's one up front.
You indicated one of the problems is food deserts. So in a free market system, how do you try to get grocers to move into areas that are underserved?
Go for it.
I can take that one. I can't really answer that question completely, but let me share with you one of a successful coalition, a broad coalition came together and helped pass legislation this session called the Healthy Food Financing Initiative. And that sets up a revolving fund that allows for federal dollars and private enterprise to get involved to help spur new development in food deserts and in low-income areas for new small groceries, for markets, for food trucks even. I mean, whatever might be available or relevant for that community. And that's a really great example of the state and a number of coalitions coming together to try to create a solution. It didn't cost us, our state, anything, but allows us now the mechanism and the revolving fund to put resources into that, even from private enterprise, to make that happen. The whole question about how food deserts evolve and come to be and why they're not covered from a free market perspective is pretty complicated as it relates to where food companies and retailers choose to have their businesses, and that's obviously they're looking for where they have the most volume. And so unfortunately rural communities really suffer because they just can't attract the retail presence that would give them greater access to healthy food. So we're excited about this new piece of legislation and hope that it will bring more to those communities.
So to piggyback on that, I think the other piece of that is right now about 80% of people who are eligible for SNAP are enrolled in SNAP. You've got 20% we could increase, that's 150,000 people almost. For every SNAP dollar spent in a community, it generates about $1.70 in economic activity. And depending on who you ask, about 1 in every 10 positions in a grocery store is paid for via SNAP dollars, right? So if we build the participation in that program, you're talking about putting a lot more money in local rural economies, potentially providing the incentive you need in the free market to put those stores there.
I might mention, I noticed in your report that almost all of the 10 most severe food deserts in the state are in western Oklahoma, as opposed to southeast Oklahoma, where so many times you see, the poor outcomes in so many areas. But
I think we have lots of areas that could use more access to food, but yes.
another question. Oh, here's one. Well, here's one first and back.
Hello, I'm Isaiah, a person with the Tulsa Health Department. I work on addressing the food access issues there in Tulsa County. One of the things we've seen being in an urban context is not so much a lack of food, but a lack of the correct types of food in food deserts. Malnutrition being from a lot of times overeating, overindulging in the wrong types. Are there maybe complementary solutions that you would pair with just general food access, such as soda tax, other things like that, that could possibly help? Because it's in places like Mexico and other areas where they've applied it, they've actually seen a substantial decrease in consumption of bad foods through that.
I'm being looked at for the tax question.
You can do the
Go
tax
ahead.
question, and then I'll try to answer some.
So as an organization, Hunger Free Oklahoma has not taken a position on taxing any sorts of food, but what I would say is you can provide incentives. So a great example in Tulsa is the double up SNAP bucks at farmers markets, right? Where your SNAP dollars go twice as far when you're buying fresh produce from farmers markets, which is great both for the individuals buying, but also for the local farmers who are selling their produce, right? And I think other innovative processes like that can help. You can provide incentives to local grocers to have the produce, whether it's through subsidizing that process or perhaps some other tool. I'm not prepared to say my organization supports any tax right now.
So the food banks, both food banks, and obviously I'm more familiar with the Regional Food Bank of Oklahoma, we've worked very hard to work on the supply of food, so to speak, that we get out to communities. And so I'm proud of the fact that last year about 24% of our total food distribution was fresh produce, and we're working very hard on that. Years ago, when food banks would get food out, it'd be a lot of canned food and high starch and high sodium and, get the food out. But our food bank, the food bank out of Tulsa and across the nation are really trying to do what we can to influence food choices in our network that we serve. So if you go to a food and resource center that's supported by the Regional Food Bank, you'll walk into a client choice environment that will have an array of fresh fruits and vegetables. And the truth is, clients and people that we serve really embrace that and want that and enjoy that. And as you pointed out, the big problem with food consumption and sort of the netty relationship between hunger and obesity is that very often people don't have really great food choices. And that also then becomes a pretty complex cultural thing around how habits are formed in families and cooking and food consumption. And so we're working very hard through a whole range of nutrition education with all the agencies we work with getting more produce out. We have fresh food mobile markets that go out into the Oklahoma City area, largely is where we have those that are distributing that. We work with healthcare providers because if you are have type 2 diabetes diagnosis, a big part of your maintenance of that illness, as an example, is your diet. And so we're at Variety Care and with other providers making sure that doctors are literally writing a prescription for healthy food, and we're there to be able to make sure people take that food home and have regular access to that. There's a number of interesting innovations going on across the country where healthcare providers have seen their costs go down when they've partnered up with food banks and other providers who can make sure patients have access to healthy food, because it really does make a difference on the bottom line. So again, we don't take positions on tax issues either, but I think it's an important conversation we need to be having.
There's a question here up front.
With all of the state budget cuts and with the federal budget cuts and the conversations that are going on in our federal legislature, I can talk. I know that in Oklahoma, our food banks and a lot of these hunger initiatives are funded a lot by oil companies. And with the downturn in the economy and the state budget crisis, are you all seeing a pushback, or are you seeing a decrease in your funding?
Take that one real quick too. I'm happy to take that one. I'll give a shout out here to Devon Energy. They've been a strong supporter of the food bank, the Regional Food Bank of Oklahoma, for many years. And despite the fact that they've gone through a really difficult period of time, as have many oil and gas providers, they have not lowered their support to us.